talk about a little bit what it is and how it works. And it's a program that was started back in 2003 by Dr. Sanjeev Arora, who's a liver specialist in New Mexico, when he realized that there was a major problem actually getting to be able to treat all of the individuals that had hepatitis C. I'm sorry, I got distracted. That had hepatitis C. Oh, see, this is what's, if I can pause for one moment, I apologize. My slides are moving on their own, and I don't know how to stop that. So we will, oh, right, so we're just gonna talk through it.
Yeah, the PowerPoint probably has it timed per slide.
These winter events cause all kinds of issues. Don't
They
they?
certainly do. So Project ECHO is something that was developed by Dr. Arora in 2003 to tackle the issue of the fact that there are so many people in rural New Mexico who were diagnosed with hepatitis C that needed to see a liver specialist and couldn't get to him within any type of adequate treatment time period, and frankly would have to drive too far. So he started using video conferencing technology to be able to leverage his expertise and use case-based learning the way that he had learned in his fellowship to teach rural primary care providers how to treat hepatitis C. And they got such good outcomes that they started expanding this to treat other conditions. And it has since 2003 expanded to be a global initiative. So it's become really huge. We have a couple other ECHO clinics that we've started here, but this is our first around integrated care. And the whole point of ECHO and the goals of Project ECHO are to use technology, so video conferencing and phone technology, to leverage scarce resources, to share best practice and case-based learning to master complexity, and then to use a web-based database to track and monitor outcomes. Because what we want to see is that this is actually benefiting practitioners in the long run. So in terms of sharing best practice, that's where all of these hub members come in, and us having expertise in a variety of areas. So like you heard, we have a clinical psychologist, we've got a child psychiatrist, child and adolescent psychiatric nurse practitioner, forensic psychiatrist, family practice, family representation, counseling. Occasionally we might have social work and peer support. And so we'll have opportunity for other people to jump in and really create an interdisciplinary type of dialogue that can create much more depth to cases. And the other piece of it is the case-based learning. So I did send out the case presentation template, and that's something that I'll talk about a little bit in depth, but we're hoping that people are willing over the course of time to actually be able to volunteer in cases so that we can all learn together and create a learning community. Like I said, so our hub is partially here today and partially off-site today. The hub is really just the people who have dedicated their time to try to come here and present their expertise, to listen to cases, who have a different frame of reference, and will be able to present some didactics, because the didactics are a piece, but certainly only one small piece of the value of Project ECHO. The spokes are all of our community partners, which today is just the two of you, and our folks who are calling in, who are kind of our hub and kind of our spokes today because they're remote. Jody and Deb both are calling in remotely, but would typically be here, particularly Jody. And we will have other people who join the hub over time, and hopefully a couple other spokes next week that were not able to join us today because of weather. So learning objectives, our goal for this series of ECHO sessions is to help individuals who participate in being able to say that at the end of this, they'll be able to evaluate individuals with difficult comorbid physical and mental health conditions with consideration to social and environmental factors, using collaborative person-centered approach to care, to distinguish level of care needed for complex cases, and to educate patients, families, and other community social supports and members in normalizing mental and emotional behavioral aspects of medical conditions, mental illness, and substance use disorders. So typical agenda. Typically when we start at 11, we will do introductions and any kind of announcements that need to be made at the beginning of the session. Then we will do a short didactic presentation, and you should have received the list of the curriculum topics. one thing to note on that list of curriculum topics is that there's a couple weeks that things are actually intentionally left open, because we want to make sure that we're able to add in any of the topics that maybe we missed that you're really interested in. So if there's a particular issue, a particular client population, a diagnosis, or really whatever the case may be, we want to hear your feedback about what topics do you want to hear about that aren't on the list. And we'll make sure that they get added into those dates. After the didactics, we will have case presentations, and depending on how long each case takes, we might have one or hopefully two. But within the case presentations, we would ask a community member, whoever's calling in, one of the spokes who had volunteered to present a case, to go over some of the basics using the case presentation sheet, which is nice to get in ahead of time so that if it's something particularly complex, the folks here at the hub can do a little bit of research, pull in extra literature, make sure that we're pulling the best evidence for you. But a lot of curbside might end up occurring as well. After that presentation, there will be a summary, and then everybody will get the opportunity to ask clarifying questions. We go to the spokes, so anybody who's calling in remotely first for their clarifying questions, and then have clarifying questions from the hub. And then we move on to recommendations and feedback in the same format. So giving everybody who's calling in an opportunity to give feedback to the person who presented the case. Our hub will have an opportunity to give feedback. And at the end of all of that, we actually will be typing up the recommendations, any of the feedback that was given, and sending it back to the person who presented the case. So the goal is that you're actually getting something in hand that's going to help to serve as a reminder for, okay, so what were the things that these folks said I should try? And that way we can even insert, resources, links, things that might be helpful or appropriate for that particular case. What kinds of cases should you present? So really, it's a pretty wide scope of cases that you can present. So things that are challenging, patients or families that present as a clinical challenge, or there's something going on that you're just not sure about, the people that you're really stuck on. And I don't necessarily want to limit it any more than that. So as complex as a person or scenario, because I think some of this stuff too could be collaboration with another community partner. You know that you need to work with somebody better to actually serve this patient, but the issue is in the collaboration or the coordinated care. So I think that those kinds of cases, even though they're not necessarily a patient, I think they're absolutely still appropriate to bring up. And so if it's a case that's a patient and or clinical scenario, we'd like to hear it. You receive the case presentation template. We do ask that you use an echo identifier on there, because what we don't want to have is any cases of us accidentally pulling in protected health information. The best way to make this run efficiently is to try to avoid HIPAA being an issue and just not using patients' names, any of the things that would be considered protected health information. So we ask that you use a generic number that's created by the first letter of the patient's first name, the two-digit day of the month that they were born, and the last 2 digits of the year. And we ask that you do that so that we can actually track over time cases that are represented. So if you presented Jane Doe, born, date of birth August 5th, 1999, that would be J0599. And let's say in 6 months you wanted to talk about Jane again, then you would say, I'm representing case J0599, and we'd be able to actually track those kinds of outcomes. Where do we see things going? How are people progressing? And is it useful to represent cases in the future? Basic housekeeping, just to protect patients' privacy. We really do want to avoid any kind of use of HIPAA information. Video etiquette. For future use, we do hope that you'll be able to join us by video. It does make things a little bit more warm during interactions. But video etiquette reminders would be to eliminate environmental distractions, silence mobile phones. An interesting thing that I've learned is keeping your mobile phone away from the microphone that you're using if you're videoing in, because it causes feedback. And a lot of people apparently don't know that. I'm glad that I learned it because it does create this weird thing that people don't then know how to get rid of, and all you have to do is move your phone out of the way. To mute your microphone when you're not speaking, just to eliminate that background noise. Test audio and video beforehand. If you have any technical issues with Zoom and you contact us, we can try to help you through that. And by say we, I really mean Jamie, because Jamie's the one who manages to get everybody worked through Zoom, including myself. There's actually a chat function in Zoom too, so when you're logged in through that on the video, if there's problems and you need to communicate and you don't want to speak out loud, you can actually communicate, you can chat with Jamie. And we are offering CME and CEU credit for participation in every session. We were approved for physicians, pharmacy, nursing, social work, counseling, and psychology, and we can, we have those certification numbers for all of that. And the only thing that we really need from participants in order to collect on the continuing education credits is for you to fill out the evaluation survey at the end, which will be emailed to you. It's an online form. Right, Jamie? You will receive an online survey, which will be the evaluation survey, and that's what we will use to be able to give you your continuing education credits. And I feel like that has to be so much more dry without the slides. So any questions from any of our spokes?
Yeah, looks like there's a new one on it.
Oh, we do have somebody that has called in. So the person who jumped in a little bit late, can you identify yourself, share your name? My name's Nicole. Three 330-564. Okay. Any questions from our folks at Beachbrook?
Hello.
Hi, Dr. Weiss.
Good morning. Good morning again.
Good morning.
I think I've got this system. I think.
Very good. Well, Dr. Weiss, we just went through a very verbal dry run of how ECHO works for a couple folks that have called in from Beachbrook. And if you want to introduce yourself real quick, and then I can see if they have any questions about how ECHO is going to run.
Sure, be glad to. I'm Bob Weiss. I'm recently retired psychiatrist who's interested in these various areas of consultation, and I do a lot of teaching. I ran the inpatient and consultation services at the county hospital in Cleveland Metro Health Medical Center for almost all of my professional career, and had academic appointments.
Very good, thank you. So Kristen and Christine, do you have any questions?
Hello. Did you ask if we had any questions?
Yes, we did. Do you have any questions before we move forward?
No,
Okay,
no.
thank you.
Thank you, though.